Thank you very much, Sue. Um, I'll get my screen up just while I just chat over it, and hopefully it comes up for everybody okay. I listened to Paula this morning from Dublin, and that was absolutely fantastic. And I do thank her for even mentioning me. That's not what I'm saying. It's just to give some background to how challenging Waterbirth has been. But obviously during COVID, it's become even more challenging for some units, individuals, and obviously, of course, for some mothers. We know some services have been cancelled. Birth centres have been closed, home births have been stopped, and that's obviously included water births. So this has been ongoing, as we all know, for a year now. A year ago we were in Ireland, and then I was just about to go off skiing and they shut us down. So I got all the way to France and then had to turn around, literally 1,000-mile trip in 48 hours. So literally got there and Macron closed the ski resort. So I'm glad I'm not heading out this year. So Sue asked me to put this together. So what I've tried to do is pull together some general information about the use of water and a little bit, as Paula did this morning, just where we've come from, and then what's changed during COVID. And I do stress for some places and individuals, water birth has just carried on, including where I work clinically. Others are at a bit of a halfway stage, and sadly there are still some places who are not offering water at all, even in places where they had very established services. So it is a real mixture of exactly what's been happening around the world. And I have to add 120 countries now to Paula's 119, as this morning we heard of another country that are still doing water births and have just developed their service. So usually when I'm teaching, I start off with water preparation to emergency evacuation, and it's just as relevant during COVID as it's been right from day one. So as I said, just a little bit of where we've come from. Evidence-based guidelines, of course, is the word that we all use now, but when we first started with Waterbirth, there weren't any guidelines, let alone anything that was evidence-based. So again, you know, the work that people like Paul have been doing has just enhanced some of the work that's been coming out over the last 30 odd years. What I always feel with any evidence-based guidelines, and I know we're not all from the UK, we're beyond, and that's wonderful, but whatever guidelines you put together, they need to be relevant and appropriate to your country, perhaps where your pool is, whether it's at home, birth centre or hospital. I say that because sometimes people pick up other units' guidelines and literally think they can just transfer them to where they work. And I stress that does not normally work well because of the huge diversity of how we provide care and where we provide care. So that's just a word of warning. If you're looking at borrowing each other's guidelines, just make sure they're relevant to where you work. So in the UK, we were very fortunate that the first guidelines that came out jointly, and this is to my knowledge still unique from the UK, were published in 2006. Now that's still many years down the line from when I did my first water birth, which was 1987. So it did take them quite a long while, but we got there, and we do have to give credit to both of these Royal Colleges to join together to write those first guidelines. They now do have separate ones, and that's probably appropriate as midwifery has diversified in its care and particularly in its guidelines. But you know, we have to give them credit for this. This is unique, as I say, to my knowledge from the UK. What's been happening with COVID? Huge amounts of papers, briefing papers relating to COVID. This is just a tiny sample that I took photos of. And it was actually an international colleague, Barbara Harper from America, who jumped and got in very, very quickly. Hers is the paper that, if you can see, it says the 23rd of March 2020. So Barbara actually in her organisation got on very quickly to get a briefing paper out about the effect of COVID and water birth. And it was about transmission, it was about treatment, it was about whether or not it was safe for the baby and mother to be in the water, what PPE we should be using. and that is continuing to be enhanced all of the time. Oxford Books, which many of us will have heard more about because of their vaccine in the UK, they also put out papers, and theirs came out on the 29th of the 4th. So again, we were leading the way with getting these guidelines out, and the Royal College have put out 3, hopefully a 4th one to come soon, because that last one, if you look at the date, is the 29th of the 7th, and we're now mid-Feb. So they are keeping up with the times, with the new research, the new evidence, the new guidelines that, from other disciplines. And we look very, very widely worldwide when we actually write these guidelines, these briefing papers. And I've been involved with the college one under my hat as a fellow now of the Royal College. But there are other people who are writing about it, and it's important we do look worldwide. You know, this is about sharing information. So we've got information there from the USA, we've got stuff from Italy, who sadly have stopped their water birth. They don't believe it's safe. There's an ongoing issue with the Australian midwives and the Australian New Zealand obstetricians. Midwives feeling it's safe, obstetricians not feeling it's safe. So even within one country, you've got 2 disciplines who don't agree. And that is a continual ongoing issue that we have to try and help and address, which is what I spend quite a lot of my time doing. What's been interesting is a change to an ongoing report. Now this study, which you can see with the little poster there, is called the Pool Study. And that was originally only meant to run for a year. And of course, what happened, they launched in January, right in the middle, or a third in, COVID hit them. So they have adapted some of their data collection. The study has now finished, but it's the analysis now that is ongoing. And this is one of the first papers that they've published, fairly frequent and only just published in January. And the author was actually on the London Festival, which Sue, I'm sure, will remember. So I'm not going to go through a huge amount, but these were the things that I picked out from the paper, as well as what was shared on the study session. So 19% of women use water in these study groups, which actually bears out roughly what Paula was saying this morning. She said about 20% of women, that's usually what's quoted. But the thing I've picked out there is the huge discrepancy between different types of birth environment. So the obstetric units, as you can see, and there were 3 obstetric units in their study they did their first review on, 0.5 to 5%, the alongside birth centre 28 to 31%, and the freestanding birth centre 61%. What they haven't captured, and that's something I've certainly commented on, is the home births, because we know that a huge percentage of women who are choosing a home birth at the moment for other reasons, not necessarily just to have a home birth, is because of the use of water. So that might be something for a future study from an ongoing pool study. I think what's sad is the limitations and what they've picked up as to why in some places water is not used. Midwife training, the culture and attitudes of staff, and that isn't just midwives, that's obstetricians as well. And it was nice this morning, there was a question asked about have any of the obstetricians at the Coombe witnessed water births, and she said yes. And I have to say yes where I used to work, and yes where I work now. We try and engage with all professionals. It's not a 3-ring circus, so not everybody just comes and watches. It's with consent from the woman, and they're expected to act as a second midwife, whether or not that's documentation, making sure the lady has plenty of fluids, whatever the role will be. So it's not that person plus another midwife. They're expected to act as a second midwife. Parents' information, we'll come on to some of that in a little while. And then finally, pool availability. And it isn't just about the pools not being available during COVID, but it's actually so many places might have 9 delivery suites, but actually only 1 pool. So you've got a 1 in 9 chance perhaps at the obstetric unit, which might be why the figures are lower. And of course, if that room is already full with somebody else who's not using the pool, that room is then blocked. So it's always about looking about these studies, but there will be more and more reports and published documentation coming out in the next few months. So keep your eye out for the pool reports. So how's it impacted on me, which is something Sue asked me to look into. So normally I would be very nicely touring the world as well as the UK to go and teach. And you've seen teaching is a big issue for midwives. So this one was at a conference in Belgium in 2019. Huge mixture of colleagues. There's one photo. I love the way they're all doing the one knee. That was before, of course, Black Lives Matter, which is interesting. Me with my doll, as you can see, that's Wendy. But at that session, we had colleagues from Italy, we had colleagues from Spain, Greece, Turkey, and India. Amit, who's the gentleman on the right, his colleague from Mumbai. So with COVID, of course, all of that has stopped. And that was cancelled very, very quickly once COVID hit the UK. So I've had to do everything on Zoom. And I think we're all getting used to Zoom now, but it's very challenging. If I had to ask one question of myself, the biggest thing is getting people to ask questions. So that's a plea, I guess, from this festival. Please ask questions. It is hard on Zoom. I do keep the groups small to try and get as many people to interact as possible. And that's very different in different countries. So when I'm running the sessions, I do try and mix and match. So we have a match of doulas, students, pre-student midwives, medics, whoever. So that mixes it up and you're more likely, I think, to get a better interaction. But getting questions from people, I think, is quite difficult. What about parent information? Because again, that came up on the pool study. I actually did these slides before the pool study published. I just love the faces on those women. That was in Wenzhou, back in China, back in 2015. And I was sitting next door to the lady in the pinky top. And we put a film on, and that was her interaction. It was just, couldn't believe what she was watching. And if you look behind her, even the other lady has a huge reaction to the film. So when I'm teaching with my colleagues, and that's usually Barbara from America, one of us will usually sit in the audience because we like to watch the interaction. On Zoom, of course, again, we have this huge problem. We don't get that interaction, and that makes it very challenging for us. Room preparation, normal room preparation, just a whole variety. I have hundreds of photos from different pool rooms around the world. Not necessarily always as aesthetically pleasing, shall we say, as some of these. Whether you like or don't like the type of pool and the room and everything else that goes with it. This is what we see around the world when we travel. And some people spend thousands on their pool rooms in preparation for that environment for the woman, which we know from the research is important. So what have we had to do during COVID? Well, top left is actually where I work. And as you can see, it doesn't really look any different. And I said to you, we've just carried on. We have changed some things. Middle photo, not from my unit, that's actually from Canada, but you can see one of the biggest changes is PPE. Some have taken it further than others. We have Greece over on the far right, and as you can see, it's the doctor who's just wearing the mask. Partner, I have to stress, please, is in the pool with the woman. That's something else that in some places they've stopped. Quite why in COVID? Because if he or she lives with the mother-to-be, the birthing person, why can't they go in the pool together? I've never understood that, and I still don't with COVID. Home births on the left, as you can see, I can't see any change in that photo because of COVID, and I can't see anything on the bottom right either. So most places have actually done very little in light of their environment. Benefits of water. Paula mentioned many of these this morning, but it was just again reminding us of the positivity, utilising our physiological skills, allowing the mother to be calm and in a non-interventionist labour and birth. And for the baby, I tend to call it optimal cord clamping rather than deferred, and that promotion of skin to skin. These are all well studied and well documented. So again, what's changed with COVID? Well, reminding us all, please, that COVID is a droplet and not a waterborne virus. When we first started, I said, Barbara, one of the biggest concerns was, could COVID be spread through the water for the mother, the baby, or the carer? And the answer from everybody is no. I'm sorry if you've just eaten your lunch. The biggest concern is about the feces, which comes up next. So studies have not found COVID in amniotic fluid, I'll mention feces in a sec, or breast milk. But of course, what has happened with breast milk is they're finding antibodies in breast milk. So again, countries that are taking the babies away from COVID positive women and isolating the baby, and often to the point of not allowing the mother to breastfeed, many of us believe are doing the baby's detriment. The feces, as they say, the jury's out. There have been a few studies that has insinuated you may find the COVID RNA actually within the feces, but does it cause any contamination that would cause infection to mother, baby, or carer? And the best knowledge we have is no. So if there's feces, as always, we get it out of the pool. Maternal care, the big change, I guess, is being much more aware of the temperature for mothers. Mothers' temperatures may arise in pools for other reasons than COVID. So look at the simple things first. Is the mother dehydrated? Or is there another infection rather than just assuming it's COVID? Testing worldwide varies greatly. Not all countries are testing women. That's sometimes purely availability or cost. Cost has not really been an issue in the UK, but in many countries we work with, it is a problem. And we're still on juries out, aren't we, about the vaccine for mothers who are pregnant and or breastfeeding. It's a balance to what's best for that mother. What about fetal care? Well, monitoring, midwives putting their hands in the pool has been a question that's always been raised on any of the sessions I do, whether it's the basic session and or the COVID session. But there's no reason why the mother or the birth companion can not hold the Doppler on her abdomen. It doesn't have to be the midwife. It never has been. I've been teaching that since 1988. And yet that still comes as almost enlightenment to a lot of people, that it doesn't have to be the midwife holding the Doppler on the woman's abdomen underwater. The issue of non-touch delivery again leads in, I didn't know what Paula was going to say this morning, although I have read her paper, but she did mention about the OASI care bundle. And that is not just about ensuring we aren't getting more third or fourth degree tears, but also that we're not trying to do the OASI care bundle, the very strict way of controlling the head and guarding the perineum. So here's PPE. That's probably the biggest change, and it varies greatly around the world. That's me as a mock-up on our birth pool. You can tell because I haven't got the top tied up. The student quickly put it on and took the photo for me to show you what we are being offered to wear. And the other photo came in from the Philippines. And you can see they have to wear a much more, almost like a hazmat suit. Yeah. You try doing a water birth in that outfit in a hot country. So PPE has probably had the biggest impact on us all. We do have to think about the equipment. We always do, but even more so during COVID. A lot of places now have gone for single use, and that includes all our flotation aids, our sieves, single use plugs, and contactless, so nowhere near the water, thermometers. If you want to know more, I suggest you come and join the sessions. What's coming out, I said we work with lots of other people. Single-use liners, please don't resell them and don't reuse them. And if your pool has been out of use, I've been working with some new companies whose whole work is about water in other situations. So if your pool hasn't been used for a while, we are suggesting it is flushed thoroughly through, and possibly, depending on where you live and work, even check the water quality. If it's sat there for a long time, Legionnaires is the worry, not COVID. So please check your water. Yeah, skills drills are impossible. We wish we could do them. These are usually poor students who get roped into actually doing the skills drills. We cannot do them. One of the companies we filmed with many years ago, they still got the film, but there's nothing like real life. But we have to be realistic. We cannot. And Paula mentioned they do their own at Dublin, and that's what we usually recommend people do. All the way through from dealing with, which is what we're mocking up on the bigger photo, shoulder dystocia, all the way through to emergency evacuation, which is that one, which we've done, as I say, skills drills and always have done. And we practice it, and we practice it where I work as well. I'm watching the time. So Waterbirths have maintained in many places, not in all. And that, as I say, often bears out on what's the establishment of already working there. Most places that in the UK have continued. Some did have some hiccups at the beginning, but most have continued now. Our challenge is for our colleagues around the world who are still being stopped to do them or are having an ongoing battle with their individual organisations. And as I say, Australia is the one that I mentioned because that's been well, sadly, published. And that's where we are, Sue.
Fabulous. Wow, perfect timing, Dianne. Perfect timing. I'm just waiting for questions to come through because I think it's something to do with the snow. They seem to be very slow this time. No, I mean, it's interesting that you, and I thank you for doing the images of the evacuation out of the water bath, because I think that's a very good example, because you actually started with that, which is an example of how you're sort of focusing to ensure it's completely safe for women and for the people caring for the woman. So that was a really good image to start and kind of finish with, if you like. I mean, do you think, especially with what's happening with with services at the moment, do you think it's going to be altered? Do you think Waterbirth rate is going to reduce because of the changes with COVID ultimately, or do you think we're going to sort of just pick up speed and catch up with ourselves?
I think we will catch up. As I say, the few units in the UK that were on sort of like a hold for a while, that was because it was all unknown. As I said, the transmission and all of those issues. Now that we've got much more information, albeit many of the studies are small, we can get that information out very rapidly to people, and then they can work through it. And we provide a lot of information, not just through my organisation, but Waterbirth International, so that we can get the most robust information we can. It is a challenge, and it's often more about services being closed because of staffing. Certainly in London and the South East, there was a huge issue initially, and then it reared itself again about availability of ambulances.
Oh, yes, yeah.
Paula did mention it, you know, being able to identify a risk happening. And yeah, she does quote me, and it's not just me, it's Barbara as well. We both say, if in doubt, get the mother out. Don't wait till you have to do the emergency evac, which I have to say in my career, I've never actually had to emergency evacuate a woman I've cared for, but I have helped other people because the emergency buzzer goes off.
Yeah.
So they are rare occasions, but they're very challenging and they're very frightening for everybody, which is why we do the practice skills drills.
So I think that, I mean, I know that you run sessions for midwives and student midwives as well as sessions for women.
Yeah.
Because I know a lot of, I mean, I can remember when we started doing Waterbirth in the unit, there were a lot of midwives who kind of, they'd offer to the women and say, well, almost like you don't want a water birth, do you? Because they didn't themselves feel comfortable in providing that level of care. Because it does, I mean, it's different, isn't it? It's like the first time you do a birth with a woman standing up or on all fours, you have to kind of think in a different way. And also thinking about Molly's session earlier, think and be very clear on physiology and your knowledge of physiology.
Yeah, exactly. And that's why for some people, I think it's learn or relearn some of the traditional care and skills that we have perhaps lost over the test of time. I mean, midwifery for you and I has changed beyond all recognition to what it was like when we all trained. And some very good, and sadly some perhaps not so good. But there's a time and a place for everything, and that includes water, and yet that's the one that's being shifted away, and so is home birth. So,
yeah, that's true. That is true. The two things, we get the strength there. Well, we've had a comment from Anne Glover who says, thank you, Dianne, but we haven't had any questions. So if anyone has a question, you have a couple of minutes to get one in to ask our Dianne, because here she is waiting. She's already said how much she loves a question to go, but I'm blaming the snow for that.
Well, my email contact, you can always come through to me. If you lose everything else, you can just type my name in and my website will come up. Because like all of us, none of us are going far. So I'm around to answer questions.
We're certainly not skiing, Dianne.
No, I know. Well, actually, I could, because West Kingsdown, where I live, we could ski down our hills here. I wouldn't be able to get back up there without my drag lift. I haven't got a drag lift, so.
No, that could be a problem, couldn't it? I think I'll just have to say a big thank you to you, Dianne. Thank you so much for sharing your knowledge and your skills and the changes wrought about by COVID. Actually, I feel very optimistic because it's interesting. It's like anything else that we've learned. I might have a question for you. Over the COVID time, is maybe things are the way they should be. Like, you know, when you go to places now, everything's sparkling clean. I'm not saying hospitals weren't, but they're sparkling clean. Yeah. Oh, we have got Lola. Lola always comes up with a question. And she says, unfortunately, there's still fear amongst midwives with water birth. Any suggestions on how we can change this, Dianne?
I think finding your other mavericks in your organisation. Don't try and be the, you can be a safe maverick, I hasten to add. I've always been a maverick, but I'm a safe maverick. Don't try and work through this on your own. Paula was very good about saying all of her team that were involved in that. There are plenty of helpers out there who will give you that information, but have the evidence, and as much homegrown evidence as you can. We hope, you know, Dublin will now move forward even more. But when we started, the only article we had was Michelle O'Donnell's 1983 article. Now we can give you information from just about every country around the world. So homegrown evidence is really good, and making those guidelines appropriate. And if you need to, start off with water labour.
The immersion rather than,
But have the knowledge of, if the woman can't get out the pool in time, about is it still safe and realistic to stay in for water birth,
or decide she doesn't want to get off. Because one of mine was that the woman was in the bath for pain relief and then just didn't want to get out. And then we had to kind of think very creatively and quickly. This was a long time ago, before I knew better. And then we have Anne Burrows says, I had a water birth during the pandemic and I'm also a student midwife. I'll always advocate water to women in my care if they're suitable. Well, big well done, Anna. It's fabulous. And Avril Flynn says, Dianne, excellent presentation. How do you think we can encourage our obstetric colleagues to get more on board with water birth?
Well, some places are very good when we teach, and I've had obstetricians on the Zoom sessions, even during COVID.
Oh, fab.
From all around the world, and a couple from the UK. So I think, yes, learning together, as we do with all our other skills drills. So yes, we always try and include them, and finding out what their fears are. I usually ask them to send in questions beforehand, so that the questioning comes back from me. It doesn't look as though it's just a paediatrician or just an obstetrician. It's amazing how little normality they ever get any interaction during their training. So the more that we can do it now and working together and having that professional respect, I think, for each other. My colleagues know where my speciality is, and I most definitely know where their specialities are.
Brilliant. Thank you, Dianne. Right, Lola says she's definitely safe maverick. Excellent. Well done, Lola. And then Margaret Richardson. Oh, hi, Margaret. I haven't heard from you for a little while. Thank you, Dianne. As per this morning, what is your view on women with a raised BMI over 35 wanting a water birth?
Yeah, I mean, we started off, I think, like Dublin did, with 30, then it went up to 35. It's knowing your BMI of your general population. And yes, we are a growing population. So, you know, we have what's called a birth choices appointment where the women will come. Usually they would come and look at the unit, but we can't do that at the moment. And we'll go through all the pros and cons. And of course, the pros are the buoyancy, the mobility. We know sometimes it can be challenging monitoring these women, particularly if the guidelines say that they have to be offered, and the word is offered, continuous telemetry monitoring. That can be challenging. Things can be worked round, but the biggest thing is for the women to understand the size of the pool, and they vary greatly from the companies. We've had women who thought, oh, it's going to be like a mini swimming pool, and are quite surprised when they actually find that the pool isn't as big as they thought, and may struggle to actually, you know, get in the pool. And then we would say to them as well, I need to know that you can get out of this pool unassisted if I need you to stand up, so shoulder dystocia, something like that. So it's having that conversation early on, not wait until the woman is like 38 weeks or arrives on your birth centre or triage. So I always tell women when I'm teaching them, they ought to be considering all of their options by 32 weeks.
Fabulous. Thank you. That is brilliant. Thank you so much, Dianne. And if we were in a hall, we'd all be going mad clapping. Thank you so much.